My name's Nathan Cheong. I'm the Managing Director of Designs for Health, and my story starts back when I was growing up. My parents took me to see naturopaths, naturopathic doctors and acupuncturists, and that was my experience of health. As I got a little bit older, my mother got sick, and actually both my parents got sick, and they were treated within the conventional healthcare system. It was difficult to see them because they had chronic illnesses, and they eventually passed away without the assistance of alternative medicine. And it wasn't that it wasn't available to them, it's just that they got corralled into a system which didn't allow the naturopathic medicine, alternative medicine or integrative medicine to actually play a part in their health. And I believe today that if that actually happened, if nothing else, it would have extended their life. At Designs for Health, we work with obviously a lot of functional medicine practitioners, chiropractors, naturopathic doctors, etc. And the biggest issue that they have is that when patients come and see them and they have limited resources around finance and support, then they struggle to continue to receive access from functional medicine, which is essentially helping them, where conventional medicine has failed them. So we get a lot of requests at times to assist with providing products for free or at a discounted rate, and we help where we can, but we feel that it's only a little bit. You know, we're only kind of helping a little bit, and really there needs to be a way that patients can actually access long-term care of functional medicine practitioners, and we'd love to help where we can. As chronic disease rates increase, as autoimmunity is becoming more prevalent in our society, increase of consumption of sugar, the increase in chronic diseases related to diabetes and obesity increases, the access to functional medicine practitioners who really have the key to assist these patients really is also rising. Unfortunately, the demographic that is really affected by a lot of the chronic disease states that we're seeing in society today are the demographic which can least afford functional medicine because they don't have access to the right education or the right tools to assist them in understanding how to actually improve their health. I can speak to a patient who was actually a patient of one of our employees. This particular child suffered from Dravet syndrome, so epilepsy. We sourced a particular strain of CBD, and the difference that has made has been incredible for that family, but also for that child. This is a child who was 7 years of age, who was essentially non-functioning, would fit up to 12 times a month. So today she's like a normal 7 or 8 year old. We did that not just because she was an employee, because we felt that there was a need there and we could help. Now, without our help, she would have been paying up to $1,000 a month in medication, as well as probably another $1,000 in doctor's bills. And we were obviously able to access a doctor, have that doctor work with us and with this person. At Designs for Health, it's really clear that the passion for natural medicine starts at the very top and it is distilled throughout the organisation. And that was really important for me coming into an organisation recently to have that feeling of passion, have a really clear purpose for what we stand for. And we can't not help individuals that need assistance when they can't afford it, because that's what we stand for. We believe in complementary medicine and functional medicine to the degree that we believe it should be accessed by everyone, not just the few that can afford it. And so that is pervasive throughout our organisation. So that's why it's so important that we have an opportunity to help where we can. And eFundYourHealth is actually a very, it speaks to our purpose. It resonates, and it can be an extension of what we do. When we were contacted or approached by eFundYourHealth, it was almost like, where were you before? It was almost like we needed this. This is like the linchpin to bring us all together and to enable us to actually facilitate people's care in a way that is in line with our passion and our purpose and our vision to help as many people as we can with functional medicine. It's a great fit for us. They share our passion, they're our kin. We want to help where we can. That's why we got on board. We were one of the first to get on board. When I saw the opportunity to come forward and be a corporate sponsor and be one of the first corporate sponsors, I felt that it was our duty to demonstrate a way, or at least show a way forward, and so that if there were a company like us going out there and doing this, then really there's no excuse for anyone else. And whilst we can say, yeah, it's in line with our passion and our purpose, well, here's an opportunity to demonstrate that it's in line with your passion and purpose as well. And so for us, it's about demonstrating that and also, leading the way, being a leader, being innovative in this space, and that's what we do. We are one, really. This industry stands for the same thing, which is to help people get better through functional medicine, to improve their wellness.